Hey, hello everyone. Thanks for today. I hope no one got lost on the way to or from the 11th floor. Welcome to the Data Ethics and Mental Health Workshop. I'm very excited to be, and very fortunate that I've been able to organize this workshop. I'm Eran Tal, Associate Professor of Philosophy here at McGill, and also the Canada Research Chair in Data Ethics. And this workshop combines two topics that I'm very passionate about. By the way, if people joining us online can quickly do a thumbs up if they can hear me, that would be great. Okay, I see a thumbs up. Excellent. Welcome to the people joining online as well. And I'm especially pleased with the remarkable lineup of speakers who agreed to join us today. So before we begin, let me acknowledge that we are meeting on the traditional territory of the Ganyan-Gehaka, which has long served as a site of meeting and exchange among indigenous peoples. I recognize and respect the Ganyan-Gehaka as the traditional custodians of the lands and waters on which we meet today. The talks today will explore opportunities and challenges to responsible data collection and use in mental health care. We're very lucky that even though it's a relatively small event with only 7 speakers, we have a very diverse set of disciplines represented on the program. So the speakers will explore these opportunities and challenges from the perspective of health outcomes research, bioethics, psychiatry, clinical psychology, and philosophy of science. Before we start, I'd like to also thank the Canada Research Chairs Program and the Philosophy Department at McGill for funding this event, and for this department where we are, the Department of Equity, Ethics, and Policy, for providing this lovely space and very 21st century advanced tech classroom. So far, no glitches, and we're already 3 minutes into the event. Very optimistic. And I'll thank individual people at the end of the event. So for those who are here in person, I hope you already had the chance to enjoy the coffee and light breakfast that's downstairs on the 11th floor. All of the breaks will happen there, and they'll all be catered with vegan food, including lunch, so enjoy. If you have any questions at any point during the event, you can ask me, or you can ask Asya. Asya, maybe you could raise your hand. She's my student who's volunteered to help. Also, Anaik, if she's here, will be able to help you with any questions. So we have, I think, quite a few people joining online. You will have the opportunity to ask questions during the discussion period just by using the raise hand feature on Zoom, and Asya will monitor any questions and help you join. Henderson is the scientific director of the Margaret and Wallace McCain Center for Child, Youth, and Family Mental Health at the Center for Addiction and Mental Health, CAMH, in Toronto. They are also a professor in the Department of Psychiatry at the University of Toronto, and very relevant to this talk, the executive director of Youth Wellness Hubs Ontario. Dr. Henderson is published widely on youth mental health, including on methods for tackling depression, anxiety, substance use, on youth engagement in mental health care, on integrated youth services, and they currently lead multiple federally funded projects that aim to improve the understanding and treatment of youth mental health and substance use concerns. In 2022, last year, Dr. Henderson was awarded over $5 million in research funding from Brain Canada to co-lead a project that is building what's called the Canadian Youth Mental Health Insight Platform. And this is a very exciting and important project that we're fortunate to hear about today. So we look forward to hearing from Dr. Henderson about the equity-related opportunities and challenges associated with this project. Please join me in welcoming Dr. Henderson.
Thank you very much. This is really cool. This kind of day is one that I'm really excited about because it takes me to a different sort of place in thinking than what I usually do day to day. So I'm going to walk through kind of a whole bunch of different sort of domains of work, of thinking, and really looking forward to discussion. So thank you for starting with a Hawaiian acknowledgement. I think it's really important. We can't talk about youth mental health without really understanding our own positionality, with thinking about truth and reconciliation, thinking about the harms caused by colonization, and in this context, the ways in which data have been used to harm others, and the unethical behavior of many people with much power. I'm a descendant of settlers. My ancestors, well, they came from all over the place, but 1600s came from France, in the 1800s, 1900s came from the UK. And I grew up with very different contexts than many people who are in my kind of position now. We didn't have a lot of money. I was the first person in our family to go to university, to go to any post-secondary, and amongst a handful that actually graduated from high school. And so I think I bring a particular kind of perspective to the work that I do, and hopefully that shines through the course of my conversation with you today. I think it's always important to understand who or how there may be influence in how people are thinking about things. So disclosure of potential conflict of interest. I have extensive funding from Health Canada, CIHR, SSHRC, and donors through the CAMH Foundation. Some of those donors I work with very closely. I like to think they don't influence my work, but part of being, I think the best we can be means we constantly question and reflect. And so that's always a question for me. Now, I get to tell you about the most fantastic work possible, but it is the ideas, and the most important ideas are not my ideas. They're ideas that came from young people, family members, service providers, all kinds of different people outside of Canada, but mostly within Canada over at least a decade. And so I'd like to acknowledge that as well. So I'm going to start by sort of walking you through a little bit of how my brain works, I guess, or not. That would be very scattered. But I'm going to try to sort of articulate for you what has been, sort of what led me to some of the thinking that I currently have, particularly about measurement and equity. But I'm going to go out wide and then come back in narrow. And hopefully this will all come together. So let's start with the discomfort. So imagine a world where every practitioner systematically measures youth mental health and substance use needs, and we have all the data we need to make the very best decisions for optimal outcomes. But wait, because that's not actually how youth mental health and substance use system plays out. In fact, what we hear instead is, I don't have time to use consistent measures of mental health. Youth will find these evaluations too long. Youth won't like being asked about their mental health symptoms or experiences. I don't see the connections to outcomes. I'm a great clinician. I'm an experienced clinician. I'm a wonderful clinician. I use my well-developed clinical judgment. There's something wrong, something bad happening.
Nothing wrong.
Okay.
Just minimize this.
Ooh, I'm like reverse. That was kind of scary.
Yeah.
I'll use my clinical intuition, my clinical skills. I don't need measures. These are the kinds of things we hear all the time. Now imagine you have someone in your family who has diabetes. You go to your endocrinologist, and they say, wait, I don't have time to use consistent measures to understand what's happening. Oh, youth will find these evaluations too long. We're not going to bother to actually measure the functioning of their endocrine system. They won't like being asked about their diabetes related symptoms or experiences. So we're just not going to do it. And I really don't see the connection to outcomes. I mean, I just use my clinical judgment and that should be good enough. Of course, it's nonsensical, doesn't make sense. The question is, why does a health condition with one of the highest child and youth mortality rates receive less vigorous health care than other health conditions? And I think that's what we need to focus on, understanding, but more importantly, solving. So if that isn't compelling enough, I've had, since about 2005, I've been partnering with young people, family members, and service providers to drive the research agenda. To really, like, I guess the problem I was trying to solve. I did my PhD in the late 90s in the previous century, just to be clear. And at that point, and sadly, continuingly, the research practice gap is really significant. Interventions that are developed with research don't make it into the real world. Very few young people actually experience those interventions. And if they do, it's like 15 years after they were created. And so my hypothesis about this, my dissertation was around closing the research practice gap. And my observation was we are creating research and we are creating treatments and interventions that don't make any sense. And they're not feasible, they're not compelling to the people we're trying to serve. What if we actually ask the people we want to serve about what they need and want from research, from treatments? And so starting in about 2005, I started sort of engaging with the folks who would be impacted by research we did to help co-design research. And so it's not only sort of the nonsensical idea that measurement won't be of use or shouldn't be part of the healthcare system. We actually hear from young people that they want action related to measurement. So these are quotes from youth who participated in the creation, and family members in the creation of the Insight platform that I'll tell you a little bit about today. They said things like stop researching me and start listening and start taking action. They emphasized getting rid of the noise and trying to find services. If you could provide services earlier and tell us if they work. I'm a clinician as well, and young people would say to me, like, is this treatment like going to help me? Like, what's the likelihood? Oh, sorry, I can't answer that question. We don't actually have really good data on that. And then how do we support youth advocacy and leadership by helping them to know which communities are struggling, which communities are doing well, and how similar or different these communities are, and how we can learn from one another. So these are some of the things they said. And interestingly, we did a big pan-Canadian trial using, well, not a trial, but a study using discrete choice experiment to understand what would be most compelling for clinicians to get them to change their behavior based on evidence-based practice. And the concept, the thing that was most important to them, their raison d'etre for their work, was that it would improve clinical outcomes. It would lead to more effective service. And yet we're still in this spot where we have been stuck for so many years. So what is the change? Well, the idea of a learning health system, and we've got fantastic people here in Quebec who have been leaders in thinking about learning health systems, is just really this idea that we embed measurement in all of our practices, and that practices can be really broadly defined, of course, includes health-related practices, but all of our practices, embedding measurement, ensuring that we actually use, like, I don't know how many of you, but having worked in the healthcare system, like I said, from the last century, even when measures are done, they are boxed up, that's how old I am, and put on a shelf, like literally put on a shelf, and no one ever looks at the data. It's like so shameful. Anyways, so, we embed measurement, And then we actually use what we've gathered to enhance our knowledge, generate evidence about what are the needs of the populations we're serving, what's working well, what's not working well, where are the gaps. And importantly, this is an opportunity to really think about equity. What's working well for whom are our services not working? And so this is critically important. And then of course, actually acting on what we've learned through that process to mobilize the new knowledge to transform the services and enhance our capacity to meet the need. And so we've been doing that through initiatives called Integrated Youth Services. And Sky Barbix here from Foundry in BC, and I'm here from Youth Wellness Hubs Ontario in Ontario. Era Vert is a similar initiative here in Quebec, and we have, and I'll say a little bit more, but these are happening across the country. And broadly speaking, the goal of initiatives like integrated youth, like Youth Wellness Hubs, which is one of the integrated youth services, is to really try to make sense of the disaster that we sometimes call a system and organize it so that young people are more able to find the services they need and actually receive holistic care. We heard very clearly from young people that their desire for a health system is not to be parsed out into tiny different pieces and have services scattered all over the place, but in fact to be able to walk in the door and say, that's it, I'm done. This is too much for me. And someone just says, okay, and sits down and helps to figure out the whole picture, not just part of the picture. And so we're focused on being guided by implementation science to organize this service maze into an integrated youth services system that has youth at the center. It includes mental health and substance use health services, primary care, employment education, vocational kinds of supports, housing and other kinds of community and social supports, as well as this broader array of skills and well-being activities, because young people told us like mental health doesn't just come from treatment. It comes from a sense of belonging, a sense of purpose, a sense of being able to take care of oneself, having autonomy. And so we have a whole wide range of supports that are offered as part of our service complement. Integrated youth services, learning health system kind of work is happening across the country. And this is the first time in what we now call Canada's history that we're aware of, where you have momentum across the majority of provinces and territories towards the same direction in healthcare. And especially notable is in my career, for sure, which has been a long duration, we haven't seen the alignment amongst young people, family members, service providers, policymakers, researchers, research funders, donors, all politicians lining up behind a single cause, as they are with youth mental health in particular. So here you have all of the various initiatives. I'm going to tell you a little bit about Youth Wellness Hubs just to sort of make it more real, because I think that'll help us have a more robust conversation when we start to talk about sort of what we're thinking in terms of data and what it means. Because I want you to try and think about it from a young person's perspective a little bit. And one of the things that differentiates integrated youth services from the conventional approach to a medical, clinical delivery of mental health care is that we start not by defining sort of the symptoms and diagnoses and the treatments, but in fact, we start by defining our values, our principles, what are the guiding sort of approaches to the work that will influence how we deliver services as opposed to what services we deliver. And this aligns with what young people really taught us, which is really like, I don't not go to service, because one of the major problems we're trying to solve is, just in case you're not deeply embedded in youth mental health like I am, I shouldn't make any assumptions. You got 1 in 5 pre-pandemic, probably 1 in 4, maybe more, young people experiencing significant levels of mental health or substance use concerns, yet 3/4 of them do not receive specialized treatment. I spent a long time trying to understand, why are they not getting the treatment? We have treatments that work, why are they not receiving them? And there's a multiplicity of factors that influence both their decisions to connect with care, our capacity to deliver care. And so when we started to sort of talk to young people about this, we talked not only about what are the problems, but how do we solve them? This is fundamentally an equity issue. Other health conditions have ready access to appropriate services. Like, imagine if what I said to you was, oh, we know 1 in 5, maybe 1 in 4 young people are probably experiencing symptoms of cancer, and 3/4 of them don't get treatment. Like, that would be bizarre. So this is fundamentally an equity issue. And so when we started talking to them about, like, okay, so what are the solutions? They said, well, we really have to focus less on kind of the widgets of service and more on the experience of service, the how of services. So as you can, won't surprise you probably even by this point, they said, we want to be involved, we want to be engaged in the design of services, the delivery of services if we can. We want everyone to work together and make intelligent decisions about the system. We want services to be accessible, really broadly defined. We want services to reflect our identities, to support our identities, value our identities, cultural, gender, whole wide range. We want services to be available under one roof, and that's one virtual roof now too, of course, but really that idea that I can just walk in and everything will be there that I need. Importantly though, they also said, I really want to understand, like, is it gonna work and how's it going over time? Like, if I'm doing all this work, how do I know if it's working? How do you know if it's working? And so we, of course, young people didn't use the language of measurement-based care, but from where we sit, this is measurement-based care. To really give you an idea, it involves a range of intensities of services embedded with that are comprised of evidence-based approaches across all of the levels of intensity. And we operate another thing that's notable or distinguishes us from other forms, conventional forms of service delivery for youth mental health, is we are operating or attempting to operate as a learning health system. Now, we can't ask individual organizations or individual hubs to somehow become a learning health system. We can, but without resourcing, without supports, without expertise, it's virtually impossible. And so for organizations like Foundry or initiatives like Foundry and Youth Wellness Hubs Ontario, what we've been able to successfully advocate for is the formation of a backbone and what we call a provincial office, where we're the hub, the glue that holds all of these other networks together. We're a network of networks, and it's within this provincial office that we have the capacity to build system capacity around measurement, evaluation, how to use data, how to do things, how to use data in ways that support equity. So for example, and I'll show you the kinds of data we gather. We work with hub leaders to learn how to examine their own data, how to examine census data, how to compare the data of young people who disaggregated are presenting for service to census data, and identify who's not presenting for service, who may be more represented than expected, and how are we gonna partner with young people to think about appropriate solutions to gaps that are identified. So what happens when we actually have communities come together and work together? We're able to sort of understand more about the use of services. Right now in Ontario, there are more than 400 separate youth mental health, child and youth mental health organizations, and they can't tell you very much at all about how many people come for service, what their characteristics are like. We have a minimum data set that includes socio-demographic, of course, mental health and substance use health needs, other needs, the services they've received, their service experience, their outcomes and fidelity to the model. So what could a future look like? Well, our vision is that every young person in Canada is supported to achieve their optimal outcomes. Every young person should have access to tailored services that will help them achieve meaningful outcomes for themselves. So that takes me back to here. We've got all of these initiatives happening across the country. How do we move beyond just examining our own data to understand locally the needs of young people, or even provincially the needs of young people and how we're doing in terms of outcomes and service experience, but actually to think across the country? You know, we have a relatively low population across a really big geographic area. And there are many more similarities amongst the young people living up in northwestern Ontario for them to the people living just across the colonial border in Manitoba than there are between those youth in Kenora, northwestern Ontario, to the youth in Toronto. So how do we start to connect ourselves across all of these different really separate learning health systems? So you can sort of think of each of these initiatives as being learning health systems within a province or territory. And now what we're starting to think about is how do we knit all of these together so that we can leverage each of our own learning to the benefit of young people across the country. So we've been funded by Health Canada. There's kind of two initiatives. It can be a bit confusing, but I'm going to tell you a little bit about two initiatives, but mostly I'll spend my time on insight. But I will flag that we have been funded by Health Canada. This really is an amazing time. We have people in all parts of government across the country who understand that we have fallen short on meeting the needs of young people, that this inequity in the healthcare system has very high costs personally, for families, for communities, but so societally and economically as well. And so we've been really fortunate, and Skye and I work very, very closely on all of this work, to be able to secure funding to build a pan-Canadian data platform that will facilitate each of the initiatives having their data come together in response to queries in order to further our understanding. Now that is all about the service data at this point. We are just emerging with research that is embedded within the integrated youth service models, but that's just starting. To this point, the data that are gathered through integrated youth services is really service data. It's used first in Youth Wellness Hubs Ontario. It's used first for measurement-based care. So it has to, nothing gets included in our set of measurement tools that doesn't have value for the young person sitting in front of the clinician at that moment in time. That's used for hub planning, and then it's used for system planning. And now we're thinking about how does it link all together. But just looking at service data for young people who present for service runs the risk of exacerbating inequities in our system, because we're not actually understanding the needs of youth more broadly. We're only understanding the needs and experiences of young people coming into centers. And so we really need to embed that data platform and learning health system in a broader approach. And so this is kind of embedding this IYS focused platform into, oh, that's okay. It just says Youth Mental Health Research Ecosystem. So it's really about embedding this IYS specific platform in amongst all of the kinds of evidence we will need in order to actually achieve that vision of every young person being supported to achieve their goals. There we go. So that takes me to the Insight platform that I'm very happy to tell you about. This is powered by RBC Future Launch with support from Power Corporation and the Canada Brain Research Fund. It's a whole crew. I mean, that has been a learning. It takes a lot of people, like, to make substantive, transformative change, you need people to come together, including donors and funders. So this started about 2 years ago, I guess, with a call for proposals from Brain Canada. You had to be a neuroscientist to apply. You can already start by thinking about how there's an equity issue there. Only neuroscientists can contribute meaningfully to work in this space. But anyways, we won't spend too much time on that. There was this call for proposals focused on youth mental health to develop a platform for youth mental health. And we initially were approached, Sky and I were approached to be part of a team that was heavily research-based, all researchers. Well, researcher clinicians, but not community. I think the differences were really embedded in community-based health services and in partnership with young people. And at first I was like, absolutely not, I will not do that. And, you know, this is about researchers being able to mine data for their own benefit. I'm just declaring my biases. And so, and there's, don't repeat this at home. No, there's like everyone is online, so this is not a surprise. But then we started working together with the team and started really thinking with a small cadre of researchers, primarily at CAMH, together with Steve Mathias, Dr. Steve Mathias and Sky Barbic, to really think about, we don't want to miss this opportunity because this could be a real benefit, but what would be the conditions under which we would participate? And for well, only Sky really knows me, but like, this is a common thing I will say. I was like, let's not do a yes, no, let's think about under what conditions would we do this? And so we proposed that this work would need to be very collaborative. It would have to be not CAMH centric, but in fact, pan-Canadian multi-organization. We would have to focus not on benefits for researchers, but benefits for young people. And researchers would tell you they're focused on, you know, developing, and just to declare, I am a researcher, but, you know, developing interventions that are going to help lots of people. But we have a system that is designed to reward people's own outcomes. So when researchers are evaluated, they're not evaluated on how many young people have been helped. They're evaluated on how many publications, how many grants. There are some organizations that embed, there's lots of lip service to impact. And I'm not saying health services research is the only kind of important research, but you can think about this across lots of domains of research. How do you capture kind of real world impact, or impact that moves beyond publications and conferences? And an international conference is better than a national conference. And no, what we really need to address inequities in our system is an emphasis on the benefit to people. And so we said, okay, well, this has to focus on the benefits to young people, their families, the health system has to be co-created with youth and families, and it has to center equity. So we engaged youth and families from the outset. You know, one of the ways we signal value of something is people with really compressed time and really tight schedules dedicate their time to things. So I personally ran focus groups every week with youth from across the country, including some representation from First Nations. Of course, this is only 13 youth. These youth, though, largely were connected to other advisory groups of youth, so they could reach in and out. This was such an amazing group. We together, but really their ideas, built these amazing use cases and an approach to governance, and we co-created a mission statement. So what did we do with Insight? Well, what we did is we thought, if we want better outcomes for young people, we're particularly interested in young people reaching out to community services. That's where the majority of young people with substance use and mental health concerns are. We need to understand more about youth in general. So that's your population level data. And we need to have access to the best available, most innovative, most well established interventions or approaches to service. And so over here, we've called it hospital-based mental health services, but it's actually that kind of high intensity research where you're doing trials to develop new interventions or new approaches to identify bipolar disorder early, for example. So if we want the best possible outcome in that center part, we need to pull all of this together. And so that's what we did. We engaged researchers from across all of these different initiatives to build an integrated, federated data platform with nodes across the country and all of these different initiatives that will allow us to access data from across all of these different sources to answer some really important questions. So what have been the challenges? Before I tell you about the opportunities and where we're going next and what young people wanted in terms of those answers, I want to take a couple of minutes to talk about the challenges. So some of these challenges were very prominently exemplified through the Insights platform process and continue to be. Some are also really, these are experiences and challenges that I've observed across multiple different kinds of initiatives that really aim to bring together these very different perspectives. So the idea of vision, which I made reference to before, why are we doing the work? What's the vision for the work is really important. Together with what's your motivation? And so when we partner with young people and family members, they're trying to make the system better, most typically. They may also have academic interests. They may also be really interested in expressing and building their expertise. But very often, they're really interested in ensuring that young people get better access to quality care. This differs from why researchers are often engaged in grants. It's not a right or wrong. It's part of how our system is, but it really does have a flavor of this is what my job is versus this is what my life is. And so, finding ways to reconcile those different perspectives and create a common shared vision is really important. We can say all we want about trying to reduce inequities in power in all of the spaces that we go into. I've worked really, really hard over many years to try and create safe spaces for youth to come into conversations or for us to go into youth conversations and talk about how we can work together to change the system. But power is always going to be an issue. I am always going to have more power in all of those situations. And unless we recognize it and appreciate and understand its impacts on the other people in the room, we're just leading ourselves down a false path. So really thinking about how those power dynamics, who ultimately gets to make decisions. And our research and data kinds of endeavors often, and this comes from funders, and I give funders feedback as well. You have a nominated principal investigator. They are charged with accountability for the grant. They are ultimately accountable for the decisions. They're ultimately the decision maker. Okay, so how are we going to work differently if that's actually the reality? If actually the nominated principal applicant or investigator can overrule everyone because ultimately they're accountable, it totally makes sense. When I'm in that situation, I want that power. But how are we going to work around it? How are we going to articulate? And this I completely learned from young people. We need to articulate our values first. Because if we articulate our values first and we have a shared vision, then we can mitigate the impact of those power challenges. And we can create a culture that is respectful of the important role that everyone plays. Now, definitions of expertise, evidence, and value have plagued research for sure, and plague academia. Academia has a hierarchy about who has the most important expertise, what kind of evidence is best, and what is of greatest value. And to do this kind of work, we have had to really challenge that and change that. We need a more equitable approach to defining expertise, to defining evidence, and to thinking about the value that people bring to a process. How we define success and meaningful outcomes also is a challenge because they differ. And importantly, things like the pace, the processes that are part of a typical both grant application process, but then the execution of the grant. Health Canada grant builds a pan-Canadian IYS platform protocol in just two provinces that we have 24 months for. For the Insight platform, we have 36 months. I mean, these are ridiculously short timelines to do something that's never been done before. And when you try to do it in a way that emphasizes equity and engagement, you are especially challenged, because when we want to center equity and emphasize engagement or act in ways that are completely engaged, it takes more time, just takes more time. And so that pace and all of the administrative processes can be barriers to addressing kind of this inequity in our system. The intellectual property, the ideas that I'm going to tell you about were generated by young people. Is that clear to everyone on the team? I've said it a million times, okay, not a million, but do people honestly believe that the intellectual property belongs to the youth? Will someone on the team be publishing without thinking, oh, actually this intellectual property might actually belong to the youth? Probably. And we run a big risk of exacerbating inequities. When we use data and we give people, and we're talking about sort of ultimately public access to data, we significantly run the risk of exacerbating inequities. So is it worth it? Absolutely it's worth it. It is absolutely worth it to try and navigate all of these things, because researchers are people too. Researchers, are fantastic, and we operate in a system that pushes us towards one way of working, and there are many, many people who are really interested in pushing back against that and operating in a different way. And when we work together, we've come up with some really fantastic ideas. But as I said, for two of them in particular, they originated, they were sparked by information or ideas that came from youth, and we've brought this sort of various forms of expertise together. So where's the opportunity? Well, youth were really clear. If they're going to contribute their data to something, they want it to work for them. They want I know there's lots of issues with Spotify, but I'm just going to say Spotify. They want the Spotify youth mental health services. They want to be able to go on to a platform, put some information in about themselves, and have the platform return to them recommendations that have considered their culture, their gender identity, their geography, their age, and returned meaningful service recommendations back to them. And so this is our personalized service recommender. Youth said, how come, all of the social media every minute, more than every minute, things are popping up on my phone based on information my phone has gleaned from my life, whether it's my search history or things it's heard me say, to personalize, the information that's provided. My phone's got to know when I am having more sleep disruption, or I've stopped exercising, or all of these different things. How come that's being used to sell me stuff, but it's not being used to help me or serve me better? And so from there, putting that together with the amazing expertise of all of our clinical researchers and others around precision medicine, really thinking about how can we build into this insight platform a personalized or precision predictive modeling approach where data going into the system are mined to identify changes and patterns over time that can be then embedded into the system. You know, you could imagine where we uncover some kind of really early indicator of things starting to go astray, say like a really early indicator of bipolar disorder. And we could push that out to all of the participating community mental health centers. Like right now, there isn't a good way to communicate with those centers. We could even push it out and say, it seems like this isn't so much of an issue for your center right now, but you ought to monitor it because we looked at the data. It's not like we looked at the data. It's not exactly that, of course, it's AI, but, or we could push it out and say, this seems like it might be an important issue in your community. We really encourage you to get training on how to do this identification or do this work. Lastly, that last point that I said earlier when I was talking about sort of the reasons why from a youth perspective, I talked about youth saying to us, and I remember very clearly, this was a youth from BC saying like, youth are dying from toxic drug supply here in BC. And I can't even get the data for my community to know how many youth have died, how many youth have presented to hospital with poisoning. I don't know the next community over. It seems like that next community over is doing better, but I can't access data about them either. I certainly can't compare our two communities to learn. I really want to be able to do that. I, as a youth leader, want to be able to access that kind of data so I can take action. And so that's from a youth perspective. From where I sit, I watch governments make decisions about how to fund services, which has some kind of approach to it that reminds me of some kind of conventional confetti throwing at a wedding. And so we really, and it's not because policymakers don't want to do evidence-informed policymaking or decision-making. They do, but we don't have data to share with them. And so from my perspective, being able to map in a pan-Canadian or national youth mental health atlas, the hotspots of need, areas of emerging need, areas of strength and very good outcomes could be really beneficial. So I'm going to stop there. Hopefully I've said some things that evoke discussion. Thank you very much.
So much, Joe. This was fascinating, and the floor is open for questions. We'll start with in-person folks. So yeah, who wants to ask? Yes, Femke.
Hi, Joe. Thank you so much for this presentation. It was really exciting. I have a lot of things that I would love to discuss with you, but I'll stick to a question which is a bit of a devil's advocate question, yes, because you wanted to raise this question. So
absolutely.
So I'm from the Netherlands, and the Netherlands is a hugely data-driven country where you cannot really express any sentence without like backing it up by data. So it's a different situation. So therefore, I've also seen the downfalls of it. What I wanted to discuss is that I love the idea that data can be like the foundation for decision making, but data means something different to different stakeholders. So when you ask people to score a questionnaire over their experiences, it means something to them. But then if you aggregate it on institutional level, it becomes something different. It becomes a process measure or whatever on or on sample level.
Yeah.
And then if you aggregate institutions, it becomes something different again, because it becomes some sort of a productivity number. And then on national level, it becomes something with a cost effectiveness indicator in there. So the data as is may mean different things to different people. And the risk in there is that if you come to the highest levels, like the national levels, it becomes sort of a rhetoric power where like people will be told, yeah, but what we know is based on your data, so you have to comply.
Right.
But
Yes,
you're
or
not
we're not
doing
giving
it.
your community money because it's based on your data.
Yes.
Yes.
And that's really interesting to me because I've been very critical on that from a methodological point of view, but I'm really interested in your perspective because you start from this equity stance.
Mhm.
How are we gonna avoid that data becomes a normative thing that actually becomes like something that excludes people because they don't comply with the norms based on these data?
Right. And similarly, it's like, who's missing? Like,
Exactly.
who are the community
Absolutely.
organizations, and especially culturally based organizations?
Yeah.
It's a knife edge, right?
Yes.
If you don't participate, that has consequences. If you
Yeah.
participate, it opens you up to vulnerability. I would
Or
say,
you only compare on one type of outcome.
right,
which is
oh,
also
for
very
sure.
common.
And that does not reflect the cultural relevance
Yeah,
in a
exactly.
context. I'd say like this is the biggest thing we're struggling with.
Yeah.
I guess our solution, and I think I'm here today because I'm really curious to hear how people are thinking about this. From where I sit, what we've really emphasized is that youth, for example, have to be at all of those decision-making tables.
Absolutely.
That's the transformation, right?
Yes.
The transformation is that I guess I lost my governance slide, but anyways, I think I said enough. I feel like I talked a lot. But
Go back to it.
no, it's okay. I think it's not in that deck. I must have deleted it by accident. But anyways, our governance model has youth sitting in decision-making roles at all of the tables. The execution of that can be so challenging though, right? Especially in the context of like the pace of things or the pressure from especially people or institutions with the most power. So government and funders execute their power in ways that like almost, they don't prohibit youth involvement, but practically they do because it has to go quickly or whatever. So I guess from our perspective, it's about articulating the values, then putting the structures in place. And these are really about ensuring that we have a wide range of voices in unconventional places. It's also about, I didn't talk about it here, but there's a whole training piece. Sky's leading a big training piece, and there's a big training piece within the Insight platform as well, because you don't actually have power if you don't have the appropriate training to use it. And so ensuring that the people we're engaging get trained, and also that we're training all of the conventional sort of people and organizations with power to work differently. Now that starts, from an implementation perspective, starts with early adopters. So you've always got your most keen and your most kind of like aligned already. In Youth Wellness Hubs Ontario, for example, now we have like more than 30 sites across the province. We're now starting to, like, the government will sometimes want us to work with communities with who are haven't yet put up their hand. And so you're kind of trying to get people to change who aren't quite ready. And so we do experience that, and we would anticipate that in like all of those government structure, all of the structures where you have conventional power that, people are trying to maintain the status quo. But I think that, I think what you've described is where the real transformation needs to happen.
Absolutely. Yeah, it's a political thing, and that's where the data thing becomes so tricky, because it has a super important, noble idea behind it, but it can also really backfire into like oppression.
Yes, and so in Canada, we have a long history of that. So data have been used to oppress and harm, in particular, our First Nations, Métis, Inuit people. And so in Canada, we have explicit practices to follow to guard against that. And I think people like Sky and I, sorry to keep saying your name, Sky, it's like setting the stage for whatever you're gonna have worked for a long time to embed those practices in all of the work we do, not just work with First Nations populations, for example. It's really about giving ownership of the data, like data do not leave until it's been approved. Interpretation of data has to be done jointly with community members, and in our case with young people. And sort of really trying to give control. At the same time, like for the Insight platform, ultimately it leaves your control, right? Like at some point you don't have control anymore. And I think that's exactly the challenge we face. Yeah. I'm just gonna grab a water if that's okay. Like 8 million degrees up here.
More questions? Yes, Anne-Marie.
Yeah, thank you so much for your talk. I think my question is a little bit related to yours. So at one point in the talk, you said we have to, you learned that from the young people, we have to articulate our values first and then agree on the shared vision. And of course, I was wondering, like, well, what if the values differ too much and then we cannot agree on this shared vision? So what do you think about this kind of like deep disagreement that could happen in this kind of process?
Yeah, I mean, in those situations, like sometimes it's not possible. And I think that's where we need people in academia, people with power, to stand with the people who don't have power and to say, well, no, actually, we won't be proceeding. We won't be able to do this initiative or do this. And we've done that, you know, because I think it's really important, first, because it's the right thing to do, but also it empowers and repositions people to be seen as people who can be influential, which then the next go around, you know, they have more power in those situations. But there are times where we can't reconcile. I've been on projects that I've had to walk away. Even if the stated values are the same, the actions have to follow the stated values. And it's hard, but it's people, you know, in this room, people in academia, people with power who have to take the first step, I think, on that. This is not a data-based, this is just Joe's opinion, to be clear. I don't know, it's probably a career catastrophe for some people, but so far it's been okay.
I have also some questions, but my first question is, how does the consent from youth work in this platform?
Right, so you had to bring that up, consent. So currently, we're at the beginning stages of developing the platform. So this is going to be the most important piece. I didn't talk about the sort of the development of the governance framework. So if you look across kind of for-profit, you know, what's already happening on the phone, even if you look into health data, sort of like use of administrative data, there isn't consent. Or it's a very passive consent. Like if you use your phone, you've consented to sharing. If you know, and so that, I mean, that's actually why I'm here today, because how are we going to do this? How are we going to? Because the sort of compulsion is to just move in that direction of like, well, we've got passive consent. Everyone's already given away their data anyways. We just, you know, we put a sentence in their you know, service seeking agreement that your data will be used for a variety of purposes, including the betterment of the world. And we've done our due diligence. And the alternative though, which is we ask every young person in a really thoughtful way to consider and to make decisions, is also fraught with challenges that exacerbate inequities. So we don't get consent, we don't include people who don't speak whatever language of the service. Like, so how do we move forward in a way that finds the right balance? And I say not the only thing, but one of the things I feel really good about is we're going to do that together with youth. We're going to try and learn. There's, you know, the WHO tried to do a pretty deep youth engagement initiative around health data access and utilization, and ultimately many of the youth said it didn't fulfill their sense of what they had wanted it to be like. So we want to learn from that. But yeah, this is the journey that we're on, I'd say. To do nothing though also makes no sense. So I am completely open to discussions about how to do it. Please tell me. Maybe Sky will tell us.
Wonderful, and let's continue these discussions over the break, but first thank our keynote speaker, Dr. Johan.